Hey there, everyone. I'm Dr. Gula, a friendly diabetes doctor, and I'm here to give you the inside scoop on what diabetes really is, how it works, and why it's so important to get the right diagnosis. So grab your coffee, unsweetened, of course. Let's dive in. All right. Let's first start with the basics. Diabetes is not just sugar in the blood like many people think. It's a condition where your body has trouble handling glucose, which is a type of sugar that our cells use for energy. Think of glucose as fuel for your body, like petrol for a car. Normally, your pancreas produces insulin, which acts like a key, unlocking your cells so the glucose can get in. It's like opens the door and be used as energy. In diabetes, something goes wrong with the system, and glucose starts building up in the blood instead of being used by your body. So just like a fuel injection system in a car when it malfunctions, you have to do something to correct it. And it's the same for your body. You have to do something to correct it, but you're not going to have any energy to do your daily functions. Now, there are different types of diabetes, and it's important to understand which one you're dealing with because treatment approaches vary different for all the different types. Now, type 1 diabetes, this is an autoimmune condition, meaning your immune system, your body's own cells, attacks the insulin producing cells in your pancreas. Without insulin, glucose can't get into your cells. So in type 1, which usually starts in childhood or early adulthood, and people with this type of diabetes need insulin injections just to stay alive. Think of it as a problem with production. There's just no insulin being made. In type 2 diabetes, which is the most common type, is the one we'll focus on today, your body still makes insulin, but it either doesn't produce enough or your cells have become resistant to the insulin's effects. So imagine trying to unlock the door with a pen key. It doesn't work any well anymore, does it? So in type 2, it's often linked to lifestyle factors like being overweight, inactive, or having a family history of diabetes. That being said, it can also happen due to no fault of your own. All right. So next, it comes to gestational diabetes. This type happens during pregnancy and usually goes away after childbirth. But here's the catch. Women who've had gestational diabetes are at a higher risk of developing type 2 diabetes later in life. In fact, they are 7 times more likely to get type 2 diabetes. So for these women, it's very important to keep monitoring them after their pregnancies. Now we come to the last, but probably is the rare types. There are a few other types caused by genetic conditions or damage to the pancreas, but these are generally less common. All right. So now let's go back to type 2 diabetes and what happens in type 2 diabetes. So let's break down what happens in type 2 diabetes in simple terms. Imagine your pancreas as a sugar processing factory. All right. So sugar comes in, it has to clear the sugar. In a healthy body, this factory makes enough insulin to match the glucose that comes in. But in type 2 diabetes, one of two things happen. Your pancreas can't keep up. When glucose comes in, it cannot produce enough insulin to get it. So it gets overworked and can't handle the glucose in your blood. All right. Number two, your cells stop responding to insulin. This is called insulin resistance. Even though insulin is there, your cells ignore it and glucose builds up in your blood. It's like having a delivery service where the packages of glucose pile up at the warehouse, which is your bloodstream, because the trucks, the insulins, aren't doing their job of clearing the glucose. Now we ask ourselves, why is this a problem? Why not have more sugar or be sweeter? Okay. So when glucose stays in your blood for too long, it is a pro-inflammatory factor. It damages the blood vessels and the nerves in the body. So this is why diabetes is linked to complications of the heart, causing heart disease, heart attacks, it can cause stroke, kidney problems, vision loss, and even amputations. It's not just about sugar, it's about the whole body. Now, here's the thing, diabetes doesn't always come with symptoms, especially in the early stages. That's why it's so important to get tested, even if you're feeling fine, all right? Especially if you're at high risk. A proper diagnosis helps us create a treatment plan tailored just for you. Knowing what type of diabetes you have is key. For example, in type 1 diabetes, insulin is needed. There's no choice. Without insulin, you will die. All right. In type 2 patients, might start with lifestyle changes and oral medications before they even need or will need to consider insulin. For the rare types, we need to know what is damaging pancreas so that the doctor can rectify the problem. For pre-diabetes, we can often reverse it with the right changes if caught early. So remember, getting the diagnosis right is the first step in managing your diabetic journey, which is usually a lifelong commitment. So diabetes isn't something you can tackle alone, or you should tackle alone. It's a team effort between you and your healthcare provider. So your doctor will help you monitor your blood sugar levels, look after your complications, adjust your medication, guide you in lifestyle changes. Think of it this way: managing your diabetes is like taking care of a car. All right. So regular checkups or services, uh, fueling with the right fuel, and avoiding unnecessary wear that will keep it running smoothly. And just like a car, catching problems early makes a big difference in the long run. All right. So I'm coming to the end, right? And here's the takeaway: diabetes isn't just about sugar. All right. In fact, it's only the first step. So controlling your sugar is only the first step. It's a complex condition that affects your whole body. And type 2 diabetes is the most, even though it's the most common form, but getting the right diagnosis ensures you get the right treatment. So guys, partner up with your doctor. He will help you create a treatment plan, stay on top of your health, because managing diabetes is a lifelong journey. But it's one you don't have to walk alone. Thanks for spending a few minutes with me today. If you got any questions about diabetes or want to learn more about managing your blood sugar, reach out to your doctor. And remember, stay sweet, but not too sweet. Bye.